The Bangladeshi community is the largest BME community in Camden, and it has the worst healthcare outcomes in Camden. Healthwatch Camden and the Health and Adult Social Care Scrutiny Committee have worked together in a joint initiative to learn from Camden's diverse Bangladeshi community about what drives and sustains improvements in their health and well-being. We gathered the views of over 300 community members in a series of focus groups conducted in their mother tongue. In February 2016, we presented what was learned to the Health and Adult Social Care Scrutiny Committee meeting at the Town Hall. We outlined how Camden's diverse Bangladeshi community experienced problems in accessing health and well-being services in Camden. We highlighted what is going well and what could be done better.
We work with Healthwatch Camden because we both had the same aim in mind. The aim is about working with our communities to improve their health and well-being. We as a statutory body of the state and of Camden Council can get Healthwatch Camden voices heard, and they as absolute members of the community working with communities can help us to understand what those issues are. What I found most useful was learning from the Bangladeshi community, which I already knew, but for it to be absolutely confirmed through meeting so many members of the community that they're not the problem, that actually the solution rests with them. They have the willpower, they just need the knowledge, the information, and be supported to make the changes that we all want.
I worked in partnership with Healthwatch Camden when we first met in the scrutiny panel, and it was discussed that to find out the needs of the Bangladeshi community. So I ran two focus groups with the Bangladeshi community. One was with the Bangladeshi women and one was with the Bangladeshi men. Recently I did another focus group with Camden Healthwatch, and that was to do with the Margaret Pike Center. There was a consultation, so there were young women who were in our center and discussed, various issues. And it was quite actually an eye-opening because a lot of the women didn't know where the, sexual health clinics were. So it was a good experience for the person who was there, so how they can improve the services and how the Bangladeshi community can access it, much better.
When the focus group actually happened, the user members were very pleased that a Bengali-speaking worker from Healthwatch Camden actually attended the focus group, and the user members very happily opened up and talked about the issues and expressed how they felt about the GP services in Camden and how they were frustrated, how upset they were, when they can't get appointments. And especially older people were really suffering as well because they can't get appointments on time. The local Bangladeshi community have definitely benefited from Healthwatch Camden projects. We actually organised two other focus groups. One was with the Bangladeshi women's group, and one was with the Bengali men's living in the local area. The issue was around health issues with the Bangladeshi community, and these focus groups actually helped to identify the needs of the Bangladeshi community, whether they have changed or whether they still remain the same.
I think the Bangladeshi Project will benefit the local community by giving them a voice, and so that their opinions are heard, and if it will improve the services.
We're going to take it forward by producing an action plan which has got the buy-in from the cabinet members. We're going to take that back to the community and say, are these the things that you think will work? And then the community will work with us on taking things forward step by step, checking things out, but accountable back to health scrutiny. It's webcast, it's in public, so it's about holding us all to account for making the progress that we want to make.